Okay, I'm recording. Now go.
Daniel?
We can't hear you, Daniel. Wait.
Oh, he just left. I think he came back in. He might need unmuted.
Yeah.
Wrecked!
Oh no. Let's wait for Daniel. Oh no. Okay. Hello. He's back. Nice. Oh, let me unmute. He's unmuted. Okay, you're here, Daniel.
Can you hear me?
Oh, you're here, but
You.
you're very quiet.
Oh,
All right, let me just turn up my game.
yes,
Yes.
please.
Hello.
More.
I put him on 200.
If you
Okay, sorry. Let me just.
go ham, bro.
All right, how about now?
Now it's much better. Thank you very much. I think Lana is now
All right.
different because she reduced their 200. Okay, based. You guys, you can start, Daniel, whenever you're ready by introducing yourself.
All right, so I'm Daniel. My position, or at least the position I'm assigned, is to be against universal healthcare. And yeah.
Nice. Lana?
I'm Lana, and my position is for universal healthcare in America.
Oh, nice. Based. Um, Daniel? Uh, heads or tails?
Heads.
Let's go. Coin flip. It's tails. Lana, do you want to go first or second?
I'll go first.
Okay. Based. Whenever you're ready.
Okay. So, my topic is universal healthcare, and I kind of prepared my intro speech. So illness, injury, and death are all normal parts of life. Everybody experiences them at some point, and everybody needs healthcare at some point. Um, Universal healthcare is the best way to meet the needs of most citizens. Universal healthcare can increase economic growth in the country, um, in- increases health outcomes, and reduces bankruptcy, specifically in America. Um, Americans get bogged down with out of pocket costs, monthly premiums, high deductibles, and copays. This takes away money from Americans that they could be spending on other consumer goods. I have one study from well, it's not a study, it's more of an aggregate of studies, but it talks about um, by the World Health Organization, and it talks about some of the ways that universal health care can help the economy grow. It talks about countries other than America, but it does specifically cite American healthcare and how it impacts consumers and how much money that they have to spend on other goods. Um, there's also another study by the American Economic Review um, where they talk about how children having access to Medicaid um, saves money and healthcare resources for the whole of that person's life. It also increases employment and decreases disability. This is actually a very new study. This actually just came out a couple days ago. And it talks about how it literally studies like congruently like different people having having Medicaid implementations and how that implementation of Medicaid affected them and costs. So they took places with similar amounts of people and at similar ages and showed that they have better health outcomes. They have better chances of being employed, and they have better chances of not being reliant on disability from diseases that may have grown and worsened during childhood specifically. So talking about specifically how children are affected by healthcare is pretty important as well. Um, Canadians and most European countries have some form of socialized medicine, with the exception of Germany. Um, Germany has some aspects of socialized medicine, but out of all of there was a study done by Gallup that talked about different countries having healthcare, um, and compared a lot of them, and it seems that a lot of the countries who have universal healthcare seem to have uh, much more confidence in their national healthcare system as opposed to their local healthcare system. Um, United States had most reliance on local versus national, whereas Canada, Finland, a lot of other countries who had universal healthcare had much more reliance on their national healthcare system than America did, with Germany being the one exception. Germany was the only country in the study that, out of 20 countries, that actually had more faith in their local healthcare. And I also did some research on their healthcare system, and they seem to rely heavily on privatized like um, healthcare, but it's like very complicated how it works. Um, so other than that, a lot of universal healthcare countries, like a lot of people have a lot of confidence in their national healthcare system, whereas America does not. Um, so, programs such as universal healthcare increase healthcare outcomes, particularly for low income citizens who do not have access to healthcare otherwise. There are a few different ways to implement universal healthcare, including the Bismarck model, single payer, public option, Medicaid, Medicare approach, and one called pluralistic, which I don't entirely understand how that approach works, but the other ones are a little we can get into later. Um, Countries that implement universal healthcare have decreased infant mortality, increased access to care, and even narrow the gap for access between rich and poor citizens. That was also included um, in the World Health Organization study that I linked first. Um, and in America, medical bills can pile up, causing medical bankruptcy. Medical bankruptcy is one of the top reasons for bankruptcy in America. I have two different studies that talk about bankruptcy in America due to healthcare specifically. One was done in 2007. And it talks about how it surveys a lot of people who have been bankrupt and talks about them talking about different costs relating to healthcare, and how they became bankrupt due to a lot of those costs, usually compounding with other factors, but like that medical expenses are a large portion. There's another study that also talks about the same thing, but is more recent. It was done in 2013, 2016. So it was after different implementations of Medicaid, allowing for more people to have access, but still noting the fact that a lot of people are still becoming bankrupt due to medical expenses. So that this proves that Medicaid is not enough to prevent things like medical bankruptcy. Um, Currently, there's also another study that just came out not that long ago, by Stanford, that talks about how medical bankruptcy was previously thought to be $81 billion of debt in the economy, but actually it's $140 billion of debt in the economy. And it's very serious how much of our economy is basically waiting for this money to be paid back. Medical bankruptcy in America is like a huge crisis that people like don't talk about. But people of all incomes suffer from injury and illness, and most Americans are basically one mistake or diagnosis away from financial ruin. Uh, America really needs to step into the 21st century with a lot of other developed nations and join other world powers to form some sort of universal healthcare. Thank you.
Thank you, Lana. Daniel, whenever you're ready.
Thank you. Okay, so again, my position is against because of multiple systemic issues in the current American healthcare. My position basically is universal coverage simply won't solve all of those issues in and of itself. we must have serious conversations about the prevailing inequities in the American health system. If you have $1 to spend on combating poverty, on improving health standards, investing that dollar, according to most health economists, won't be most useful in investing in a universal healthcare system. And the reason is because there's so many prevailing issues, in my opinion. Right, so it's not really feasible to implement a universal healthcare system without combating these issues. Also, the industry has too much influence over the government, over government spending for a universal healthcare plan to work. In theory, a universal healthcare plan is supposed to get rid of wasteful administrative costs, but we don't know if this is the case if a system is going to be implemented. Many of the countries cited in related to universal healthcare efficiency are very much not like America, and most health experts would agree that countries that are homogeneous and smaller are more likely to or more easy to yield positive outcomes for. Americans, again, common source of criticism is that they spend a lot on healthcare and have worse outcomes, but there are ways of explaining those differences. Higher poverty rates. The U.S. poverty rates exceeds most countries in the developed world per capita. And yeah, so universal healthcare won't solve all the issues that currently impede upon our system. The significant factors like poverty, like racial inequality, like all of these systemic issues found in healthcare, they will continue to persist under a universal system. America, again, already spends 17% of its GDP on healthcare, more than any other nation, as I said before. But we need to analyze the limits of what we're able to provide currently before promising it free for everybody. The taxes needed to pay for universal healthcare will slow down long-term economic growth, and we need to have an honest discussion of that trade-off. The cost of healthcare will rise. More people are going to the doctor. More people are going to have access to care, and we don't know what that outcome is going to be on the doctors, on the actual medical professionals participating and uplifting the system to begin with. We don't know how this will impact, or we have an idea of how it will impact competition. And many of the countries that, rely on American innovation, many of the countries cited in these universal healthcare sort of studies, they rely on American innovation. And countries like those are struggling to come up with innovation without the private sector. It's not a given just by virtue of implementing a universal healthcare system that the government will provide consistent quality healthcare at an affordable price, especially when America, again, is not like many of these countries cited. It's not homogeneous. It's not it's not a small country. It's one of the largest countries in the world. So we do not know, and we cannot gauge whether the government can provide consistent care to all Americans and regulate the system in a way to prevent influence from other industries. I mean, we already have a very fractured political system. How can we ensure that this won't influence the outcome of quality in regards to a universal healthcare system being implemented? And again, America is a place of innovation in regards to the global, public health specter, if I may say. We are number one in the world for our aggressive breast cancer testing, our CT scanning. We're number two for MRIs per capita, second highest for MRIs per capita. And cutting edge technology can be jeopardized by putting in place universal systems for that. We are leaders in healthcare because of our system. And besides all of that, Like it can reduce the quality of treatment some individuals may receive. Just because you're investing more in healthcare doesn't mean you're going to receive good outputs. And again, we spend already 17% of our GDP on healthcare. That money can go to solving these systemic issues I've mentioned, right? There are reasons to America's exceptionalism, and that's not always a good thing. The healthcare system in America is obviously not the best, but 90% of Americans who already have insurance, and most of them comparable to the amount of Canadians or Europeans who are satisfied with their healthcare. They're satisfied with their healthcare. And, changing the system will disrupt not only the people who are satisfied with the private care package, but it can disrupt the doctors, the nurses, the people who are participating in caring for these individuals to begin with. Also, there's a reason why Americans have better survival rates, better cancer survival rates. They're better than other, countries. We live longer, typically 11 years longer after diagnosis, but only 9 years after diagnosis in Europe. So, yeah, I guess that's sort of my long-winded statement. There are systemic issues that America is yet to resolve, and these will impede upon the implementation of a universal healthcare system.
Thank you, Daniel. Lana, whenever you're ready. Lana, you're muted just in case.
Oh, sorry
Yeah.
about that. So anyway, so there are different ways to implement universal healthcare, and I think Daniel is kind of like arguing maybe against like the type of model that maybe like Canada has, where they're talking about where they have the government pay directly for all services, and how you think that maybe like that money can be used better. Sorry, there's a lot to respond to. I took some notes. So one of the things that you talked about was wasteful administrative costs. That already happens in America. There are so many costs related to communicating between insurance companies and doctors, and sometimes any sort of subsidy or any sort of tax credit that is related to acquiring healthcare for any particular person in America. I've personally lived through having private insurance, Obamacare, and Medicaid. I currently have Medicaid. I had Obamacare for a couple of years, and when I was growing up, my mom had private insurance provided to her through her employer. No matter what you have, you're going to be wasting a lot on, calling people and making sure that, like, basically the service that was or is going to be provided is being paid for by someone. That is, like, inherent to the political, or to the current American system. I actually thought that you were going to talk more about Canadian wait times, so I prepared a lot on that. So for example, a system like Canada, that does have wait times. Like, they do have slightly higher wait times than America does. But for example, I don't know if anyone in here lives in America, but one of the examples they use is spending 4 hours in emergency. I've been to emergency multiple times, and that is literally the same wait that you get in America. They do have higher waits for things like normal doctors, but they do actually, the reason that they have higher wait times for a general practitioner is because they basically are trying to reduce overuse of the healthcare. So what they do is they make it so you have to go to a normal practitioner before you can see a specialist. And I think this is why like their system is bogged down. This is something that we probably wouldn't do if we implemented like a public option. So you basically just implement what we have already with like Medicaid or Medicare, probably some combination of it depending on your age. And then all you do is you just have the option to have public health care. So one of the problems in America is that like a lot of people go bankrupt because they don't have any insurance at all. If you are if you're self-employed, if you're an independent contractor, if you just have a job where the insurance is too expensive, you just have no other option. If you don't like your employee, like my mom, for example, she was offered to give me insurance through her job, but she had to pay about $400 a month for me and her. That's pretty ridiculous, especially because honestly, if we paid out of pocket, it would be cheaper. But if we were ever to go to the hospital, that would probably bankrupt us if we didn't have insurance. So it's better to have insurance than not to in America. But the problem is a lot of insurance is super expensive. Um, this is like a huge problem for a lot of people. The um, the World Health Organization also backs up what I'm saying, that people basically are being oppressed financially by the system that we have now. It's not very helpful. It doesn't actually improve quality of care. And a lot of Americans are not satisfied with the care that they get. A lot of other countries, let's see, which one was the study that I cited about satisfaction in care? Let me find it. For the amount that Americans are spending, the quality of care cannot make up for this disparity in spending. This is a little out of date, but this is just like an example of like how the quality of care is significantly higher. Or I'm sorry, the cost of care is significantly different. There is no difference in quality that would make up for the costs that we have now. And a lot of it is related to the administrative costs that you were talking about. And let's see, what was the other point that you mentioned? You also mentioned that higher poverty was the cause of, let's see, you mentioned higher poverty was the cost of, or was an explanation for why people are, I'm a little confused. You said something about higher poverty levels like contributing to why people can't pay for healthcare, and that's not actually true, because if you are poor enough, you should be able to have access to Medicaid. The problem is actually middle class people. They're the ones who can't afford healthcare. And you would think if you have a good paying job and are arguably more likely to have access to healthcare, that you would have better outcomes. But the problem is, even with insurance, sometimes your lack of insurance doesn't help. It also doesn't help that a lot of times there are very high deductibles. And also, all of these insurance companies compete with each other, and hospitals compete with each other. So they actually don't even post their prices a lot of times. I recently saw something talking about how there are going to be new laws where they're going to be stricter on penalizing hospitals for not publicly posting their prices, because hospitals won't post their prices, and then insurance companies have these secret agreements on whether or not um, like they'll pay for services or how much they'll pay for services. And so a lot of the prices that people even pay for healthcare are completely secret. And this would completely be eliminated with something like universal healthcare inherently, because at that point you generally have either a very large or a universal, in some cases, because you may or may not have private insurances coexisting. But even if you don't, you'll still have a majority payer that has a public price that has already been negotiated. This is what how like insurance companies do already, but because there's one major player actually negotiating prices with all of these hospitals on all these specific services, then at the very least people have something to reference, whereas everybody has a completely different insurance. So at this point, like, you can't actually know what a hospital would charge you versus someone else until you actually get the service. Most of the time, if you call an insurance company, they'll give you a different price than if you just like pay the bill right out the gate. Um, and you also mentioned that we spend 17% of our GDP on healthcare. That's insane. That's insane for the type of healthcare outcomes we have. For a developed country, we have insane infant mortality levels, like, compared to other countries. It's so ridiculous that we would be a first world nation with the best healthcare in the world, but for some reason we still have like higher rates of infant mortality than all these other countries. It's ridiculous. There's no reason for it.
Thank you, Lana. Daniel, you can respond whenever you can. Whenever you want.
Yeah, sure. So, I'm gonna sort of zero in on 2 points you made. Um, Firstly, infant mortality rates, the way we report infant mortality rates are different than other countries, and the data regarding infant mortality rates are inconsistent and they're not necessarily accurate. So, for example, hold on, let me just scroll down. Right. So, our infant mortality rates is not, well, the data being collected around it globally is not really consistent and not really reliable in a way to make like these sweeping, characterizations of our, condition being so much more inferior than other developed countries. So, for example, our sorry, our infant mortality rates, again, varies in the reporting of birth. So, sorry. So, all right. So, in infant mortality rating, in France, for example, a baby has to be alive at the time of registration, and that could be like as much as 2 days later. But in America, if a newly born infant, just takes one breath and dies, it is recorded in infant mortality stats. So this sort of like inconsistency needs to be addressed, and we definitely need to improve like global health surveillance and make sure it's more consistent when it comes to collecting these statistics. But when you account for like these discrepancies, we're really not that far off. Okay, so the price the cost of pharmaceuticals need to be considered as well, because although America might have higher pharmaceutical spending, with innovation, America and Switzerland, and if you've noticed, Switzerland is a little bit higher in regards to how much people pay for their healthcare than other, developed nations that are compared in those types of studies, have the highest number of new chemical entities. So we are innovating. We have these breakthrough drugs sooner than other nations. Though this might not justify the high, prices. Again, I don't see why a universal healthcare system will necessarily change those prices. We already spend 70% of our GDP on it. What is universal healthcare going to do? Will we spend more? Wouldn't it be better if we like allocate our GDP more strategically so we can, be able to regulate pharmaceutical industries before jumping into a universal healthcare plan? Yeah, so I'm looking at my notes right here. So economists actually, sorry about that. Right, so current outcomes on a state-by-state basis to expand healthcare access through, the sort of use of government programs and mandates, as seen as in Tennessee, have been pretty disastrous. And again, I think reducing this can stifle R&D competition and stifle innovation. Americans have access to cutting edge medicines that people in the other places in the world don't have. They don't have those long wait times. They don't have to, fly over from Canada to Michigan, as you were alluding to get a hip replacement, and without like waiting for months and months on end. And yeah, I think that by regulating industry and, essentially forcing the private sector to cover individuals who would not be able to afford it, regardless of their class, that can be more effective than um, universal coverage implemented by the government. Yeah. Sorry, I'm just trying.
You mind if I ask a question?
Yeah, sure, go ahead.
So the infant mortality data collection, can you like so which do all countries except for us collect it differently, or is it like only like World Health Organization, or like how are you comparing them?
Right. So a lot of developed countries collect infant mortality rates like the day after or 2 days after. That's how they quantify them. Um, and in America, we do it like just when the baby's born. So it's not really fair to compare our infant mortality rates to those infant mortality rates. So yeah, that was the way I got to that decision, I guess.
Wouldn't that mean that our stats actually underrepresent, like, because if an infant dies within the first 2 days, we wouldn't record it, but they would?
No, because the way they quantify it is because they need to be alive at the time of registration, and that doesn't account for babies being born before the time of registration. So our sort of health surveillance system accounts for that, and other, health surveillance systems of developed countries don't really account for that. And like Russia as well, like they deliberately like exclude from the report of like infants less than 1,000 grams, or like premature like babies dying. So it's a little bit different, and there's a lot of inconsistency in regards to how specific countries record this information and submit it to like, you know, um, organizations like the WHO for analysis or whatever it may be. So that was what I was noting.
Gotcha. Okay.
And
Did you
also, oh, sorry, just
okay.
one last thing.
Yeah.
There are like issues in America that also affect infant mortality rates that we have higher rates of, like teen pregnancies and um, all these other factors. So these significant factors won't necessarily be addressed by a universal healthcare system or universal healthcare plan. And these are issues that are fairly unique to America in regards to like developed systems. So yeah, that's my digression, I guess.
So I'll come back to the innovation, but I do want to talk about, so I do think that universal healthcare does actually address um these problems. If you implement universal healthcare, as opposed to having the system we have now. So for example, if you have a private health insurance, every time you get a new employer, your insurance changes. And a lot of healthcare insurance companies are starting to implement aspects of preventative healthcare. If you have universal healthcare in some form, the government is the main one paying for services and can standardize the type of care that people receive. Currently, your doctor or your health insurance company are the ones that will probably dictate the types of preventative care that you will get. if most people are on the same type of care, then they can standardize preventative care and make it more accessible, use it more often, especially because it reduces cost. If you do preventative care, like for example, like giving people nutritional counseling and stuff like that, if you give people information on sexual education at like an earlier age, maybe standardize the fact that teenagers can be given sex ed, if not from their school, then from their doctor, especially if they're able to ask questions. You can standardize these types of practices if you ensure that there's a large bargaining power that allows for these. Like basically the government can tell healthcare providers, like, you have to do this. This is preventative. This saves us money. And you can actually like just implement that could be a big part of universal healthcare is preventative cause. This is a newer field, so they haven't had there hasn't been as much research on preventative care other than the fact that it does literally reduce costs. But otherwise, like, you can just implement aspects of preventative care into universal healthcare. This is more difficult to do when people generally have their healthcare reliant on their employer. So if the service is very cheap, doesn't want to spend the money, then they may not put effort into as much preventative care, or it may be inconsistent in the types of preventative care that it delivers, just because of the nature of like how um like it's kind of common for people to change their healthcare because of this. If people have the same consistent care over their lifetime, you can standardize these things and it's much easier. I also wanted to say on innovation, that most people are, or like a lot of innovation in America happens in universities and a couple of hospitals. But like universal healthcare wouldn't necessarily end innovation, because a lot of the money that is spent on services and everything doesn't necessarily go to spending on creating new drugs. A lot of universities will do medical research, and that won't change with universal healthcare. On the other hand, there are research hospitals that do intentionally do those things. And instead of spending money on care that should have provided to people when they were a child, you can just spend that money on the innovation itself by directly giving grants um, to like research hospitals and stuff. But we currently can't do that because there's no way to really regulate the whole industry. Like, private companies have to decide to do this on their own. Whereas if you do have universal healthcare, you can ensure a consistent funding to universities, especially incentivizing ones that seem to promote the most outcomes and produce the most research. But currently, that's not even how we do it. Like, most of the healthcare that you buy doesn't actually fund research anyway, so it doesn't matter. There are companies that are incentivized to like sell their medicine, like insulin, but you also shouldn't incentivize people at the cost of people's lives, like how insulin is so expensive, that people can't even afford care. You have to balance the idea of innovation with actually innovating. Like, the formula has been changed multiple times, but the only thing they're actually changing is just to renew their license on like having a monopoly on it. They're not actually changing insulin or innovating. They're just making sure that they keep their license by changing the like preservative in it. And that's not actually innovation, and that's not what paying for insulin rewards. Insulin was obviously made years ago, and it should be more affordable for people. And things like the COVID vaccine, governments are willing to shell out a lot of money to pay for care that people need, but only when it's like it aligns with their agenda. And right now, there's so much medical bankruptcy, and it's not worth it for people to end up having to pay it with their taxes for these bankruptcies that need to be bailed out, um, because people file bankruptcy, as opposed to just paying for preventative care before people have to like go through all this disability and disease and like long-term issues. It's just a lot easier to do preventative care, standardize it, and then not have to deal with medical bankruptcy.
Well, it's funny that you mentioned that because America actually, wait, I'm not sure if I caught your point, but like America like consistently outperforms other countries in terms of preventative measures. Um, yeah, for example, it has one of the highest, I think I alluded to this earlier, has one of the highest rates of breast cancer screening among women 50 to 69, and the second highest rate after the UK of flu vaccinations among people age 65 and older. So we're definitely like world leaders. It's not hyperbolic to say we're world leaders when it comes to our preventive, form of healthcare. The issue is, like Lana mentioned, is that we have, bad players in our system, like any system, like insulin oligopolies calling the shots, and these sort of issues, issues like medical error, like our infant mortality rate, aren't going to simply be alleviated by universal coverage. The government, I said this earlier, it can't provide quality care without, it can't provide quality healthcare and at an affordable price without, industry infringing upon that, goal. In my opinion, we'll need to empower non-government private sector healthcare system to cover all Americans and regulate the system. So in the future, universal healthcare is possible without this infringement. So America outperforms its peers when it comes to preventive measures, but we do have an interesting situation here when we have these oligopolies that are unregulated and have much say in Congress and have much say in policy and have special interest groups, literally gunning for this to never happen. And because of those pressures and because of strong Republican opposition, it's just simply not feasible to implement it. And these, systemic issues, again, like medical error, like they're not going to simply be solved by a universal coverage system. Yeah.
So your argument is because Republicans oppose universal health care, we shouldn't do it? Or am I misunderstanding?
No, I'm just saying because of, additionally, again, like with addition to like my previous arguments, the issues of, medical oligopolies, healthcare, this isn't necessarily policy in healthcare companies' interest, which is not necessarily a bad thing. And because it has strong Republican opposition, it's not very feasible, despite it being a relatively popular, policy among the American people. If that makes sense, I can clarify it further.
Can you clarify further? Like, what do you mean by like, who are the oligopolies? Like, are you talking about like Obamacare and stuff, or are you talking about big healthcare insurance companies?
More of the latter, but there is wasteful administrative spending that comes from both sides of that. Right, so like insulin, like you mentioned, it's not necessarily innovative, but insulin companies aren't very regulated, and if our government spent, more of their resources trying to regulate and trying to bring prices down, again, insulin is like a very significant oligopoly. It's one of the biggest. It's most significant, one of the most significant in America. So if we spend our resources in trying to regulate that, and we could cut down a lot of those costs for regular Americans without having to implement a universal coverage.
Well, currently, like there are a lot of insurance companies that lobby to make sure that, that their interests can't be regulated. So there are politicians who are incentivized to not really regulate the industry, both in terms of bringing down cost of actual medicine and bringing down cost of insurance, because it would, hurt their interest. If you bring about universal health care, on the other hand, the government is footing the bill. So they will have more incentive to cut down costs where they can. Um, you can definitely implement ways to, it depends on the type of universal healthcare you implement. But still, if even if you have like a public option where, you take basically the people who are on Obamacare now, you take a majority of the people on Medicaid, um, or you take people on Medicaid, and then you take people who are uninsured currently, and if you put all of those people into one insurance company, because you basically get rid of them and you replace them all with like a Medicaid for all, with like maybe some sort of like an Obamacare type tax subsidy where you have so much to pay, but it's based on like your income. Then when you do things like that, you're still having people pay for their care on some level. You're not necessarily getting rid of doctors that already exist right now. You're just adding a huge bargaining power for a lot of people who have insurance. Anyone who doesn't like their private insurance can just switch to the public option. And then you also incentivize the government to actually regulate these companies and talk about what costs they should and shouldn't use, or like what costs are too high. Like for example, like the government would probably just like take possession of the patent on insulin, because it would be so expensive to pay for all of these services that it would just be cheaper for people to like for the country to just own the patent on insulin, and just make it super low cost. But there's no reason to do this currently because there's all of these different lobbyists who are vying for a lot of different interests, and they have a lot of money at stake, so politicians have a harder time actually implementing these changes. Whereas if you literally use collective bargaining power, the government is incentivized to make these changes.
Okay, catching your drift. All right. Yeah, and that was sort of like what I was basing my argument about. Like, there's like so many, there's so much, dark money being moved around. There's so much people being incentivized, so many politicians being incentivized to rally against this, even though it's like a pretty popular, policy, that it's just going to be, I think it's unfeasible currently. And yeah. So if I can expand upon that, I'm going to go a little bit out of this, current discussion. There are issues. There are clear issues with our current system. Americans had fewer physician visits than than our peers in other countries, other developed nations. And that can relate to a number of things, like low supply of physicians in the US. But this is also an issue in other countries like Japan, where there's a lower supply of physicians. And we can't necessarily trace these all back to a lack of rather universal healthcare adoption, but it can be traced to adopting a universal healthcare system may even exacerbate these issues. And again, it could result in medical talent leaving the field or not even trying to enter it begin with, which can exacerbate shortages which have been, created by the pandemic and so on and so forth. Shortages that are already currently in the American system. Again, it could be a violation of civil liberties. There are definitely going to be physicians who do not want to work in a system that is universal. They might not be satisfied. How can we ensure that not only the American people are covered, but physicians and healthcare professionals who are participating in this, in this system are not subject to unwarranted and unnecessary oversight by the government in healthcare decisions. Yeah, and again, with things like Obamacare, a lot of people cite, the unnecessary administrative costs, the wasteful administrative costs applied to private coverage, but the same thing applies to Obamacare, in which there is, persistently, high administrative costs. With the Affordable Care Act being, passed, which is, again, as you know, the closest thing we have to Obamacare, there are new, there are new overhead costs. There are new projections. I'm citing the Center of Medicare and Medicaid Services. They project that 2.8 trillion in spending for private insurance overhead and administering government programs. That's just administrative costs, and including 273.6 billion in new administrative costs can be attributed to the ACA, and nearly 2/3 of this new overhead will go for increased private insurance overhead. So a lot of these private insurance administrative costs are even sometimes less than what is attributed to the ACA, which is interesting. And also with the whole innovation thing, our peers in Europe are definitely struggling with this. The NHS is still struggling to, make the most of innovations, and I think roughly I don't quote me on this though. This might not be a good thing to cite at this moment, but they make approximately half. Like they don't make nearly as much innovation as we do, and yeah. So there are clear issues in this big universal program in which you have situations where innovation is stifled, as I keep mentioning, and the government simply cannot provide quality healthcare, despite, and again, we have clear issues with less physician visits and stuff like that. There are clear issues, but again, I don't think a universal healthcare system will alleviate these issues, and there is a sort of like civil liberty sort of element to it. The people participating in the healthcare system might not necessarily want, and this is something we still have yet to see and experiment with because we obviously haven't implemented this yet, but there are going to be a lot of physicians and there are going to be a lot of healthcare workers who are not going to be happy with this, and we already have shortages in regards to our healthcare workers, and we have we have doctors who can't even find work after they can't even find residencies. So there are clear issues with our healthcare system. There are clear issues when it comes to infringing upon healthcare professionals' rights, and there are not everybody's gonna be happy with this. There's a lot of people who are not gonna be happy with this, and we can't ensure that we will have a strong healthcare sector to begin with or to end with, in regards to implementing a universal healthcare system.
Okay, thank you, Daniel. Lana, you are allowed to respond, and then you have to do your closing statement. And since you started, I'll make the last closing statement Daniel's, so it can fair out. Go ahead, react, do your closing statement, make a mix of those if you need to, and then we'll leave the last thing for Daniel, and then I'm gonna judge you. And yeah, go ahead.
Okay. So I just wanted to say, so in response to you talking about the ACA, the reason why they have high administrative costs is because the reason I mentioned that I've personally had all three types of healthcare is because a lot of people don't actually understand what the ACA or Obamacare is. ACA is basically a bunch of companies that are still private insurers who just also somewhat get paid by subsidies based on like government collected statistics on your income. So the reason that they have higher administrative costs is because you have to have lots of paperwork relating to your income, and like a lot of government forms and government data collection involved with also a private insurer. So you literally get the worst of both worlds because you're combining government bureaucracy with like also the overhead of a normal company where you're not just like paying for every service. You have to have the government and those private insurers like communicate on like what that means, which is literally like super inefficient. Um Things like Medicaid don't have the same issue. I also heard you say something about innovation, but I didn't say who you said innovated more. So I guess I'll just skip that. But I guess I'll just close then. I did want to say that universal healthcare would save America so much money. We're going to be ending up paying billions and billions of dollars in bankruptcy for people who would probably be better off with universal healthcare anyway. Um, it leads to more preventative health care for a lot of people. And you're citing the fact that America has really good preventative health care, and they do if you're
and you have the
insured.
courage enough
If
to
you don't even
speak it,
have insurance, you're not going to
it will
get any
happen.
of this health care. And you're sure as heck not going to have any of this preventative health care. Because if you had you're having this system where people have to pay a lot of money and they have worse outcomes for it. There are people who have really great health care, and there are people who don't have any insurance at all and refuse to go to the doctor because they have no other choice. And you're basically letting some people live in a third world country in terms of their like access to care, and then other people have literally the best healthcare in the world. um, it would be way cheaper for America to just do universal health care as a whole nation because you're going to end up bailing these people out of bankruptcy either way. You also end up wasting a lot of money with providers and insurance companies and the government sometimes in the case of ACA, all talking about negotiating prices and all of that, and who's paying for what and who isn't paying for what, and then bill collection and then debt collection
Hey,
and
this guy
then
aí,
filing
man.
for bankruptcy.
This guy aí, man.
That's what healthcare
Almost,
in
this
America
guy
looks
aí.
like right now.
Hey.
And we need to change it. Um, we could have way better outcomes for people, and we could have way less debt. So that's my final point.
Thank you. Daniel?
Right.